So let's talk about insulin in PCOS. What role does insulin play with PCOS?
Insulin and PCOS are very interconnected and has a big role. Okay, let's look into it in detail. Do you know what is insulin? Have you heard about
I've heard
insulin?
about it with relation to diabetes patients.
Yes, exactly. It is used as a treatment in diabetes, right?
Okay.
Because some people don't have enough of insulin or they are not sensitive, then they have to take it, right?
Absolutely.
Okay.
Absolutely.
So insulin is something which is related to the metabolism of glucose, the way we use glucose in our body. So what happens in the glucose metabolism in our body is that from the food that we have, the glucose is broken down into small bits and it is absorbed to the bloodstream. It is circulated all over the body.
All right.
So every single cell in our body, whether it's the brain or the muscles, to act, it needs energy, just like a car will need petrol.
Absolutely.
So this glucose is the fuel.
Okay.
So from the blood circulation,
All right.
these glucose molecules, they need to get inside the cell.
Cells.
So imagine that there is a security guard in front of every cell,
Okay.
which says that glucose in, stop, we have enough, stop, stay, go. So there's something called a receptor, that is an insulin receptor
All right.
with the coating of every single cell.
All right.
They're like the security guards basically. So
Okay.
they control the intake of, the glucose going into the cell.
Okay.
So in some people and in some women with PCOS, what happens is that these receptors or the security guards,
All right.
they are actually not sensitive to insulin,
Okay.
which is the key person or the key thing which will allow the glucose to go in.
Okay.
So the security guard should actually recognize the insulin which says that take the glucose in.
Yes.
So this person doesn't recognize the insulin. So insulin is a hormone which regulates the intake of glucose into the cell. So you have lot of glucose running around the blood,
Absolutely.
which needs to go inside the cell.
But is not going inside
because
the cell.
this receptor or the security doesn't recognize the insulin. So the
Does
receptor
not allow
is
it to go inside.
so there is a problem of insulin resistance
Okay.
because this don't recognize. So what happens to the glucose in the blood? It doesn't get inside the cell.
Reduced.
So imagine the situation where your cell have to work without a fuel. What will happen?
Breaks down or anything.
It doesn't work.
Yeah, it doesn't work at all.
It doesn't work. How does a car run without petrol?
If only
It doesn't.
stops, yeah.
So every single cell, your brain, your muscles, they stop
Entire body.
working properly because they don't have a fuel.
Yes.
So you become lethargic, you become tired. It doesn't work.
So that's the reason there's a lot of
Lethargy and tiredness in PCOS because of the insulin resistance.
Okay.
And imagine the bloodstream where you have plenty of glucose which is not taken up. What happens there? Your glucose goes up.
Absolutely.
It's almost like diabetes. You have too much glucose in the stream, but too less inside the cell.
Exactly.
So it's almost like a diabetic condition. So when the glucose is high in the blood,
Yes.
the body produces more insulin, rather secretes more insulin, trying to get them inside.
Okay.
So the insulin also goes up. So you have high level of insulin, but it's not working, and high level of glucose,
that is
which
not-
is a cycle.
Absolutely.
So what happens is that
It's not.
you're always tired even with a lot of glucose and even with a lot of insulin. So you have high insulin in PCOS
Okay.
and you tend to become diabetic because of this problem.